Good morning, everyone. Good morning. I am one of the proud denizens of table number 2. We are the Zen table. So very, very calm, but also excited about the HFG event we're having today. Again, my name is Knott. I'm the Chief Business Officer of Apt Associates, and we are more than 3,000 people around the world working to improve the health and well-being of the people that we all want to serve and work for. We're so excited this morning to be launching and kicking off this HFG Into Project event. We feel that we have 6 years of impact, of stories, of really miraculous advances to share with you. So I mentioned we're more than 3,000 people in the room. We have some of those 3,000 people. So we have some of our country managers and chiefs of party. I want those of you who are just named to sort of stand up for a moment. All right, thank you. So those are people who are going to be here during the day. Those are the people I think who are full of stories about the stories behind the statistics, right? We're going to talk about impact, we're going to talk about advances, but it really comes down to the human face, and those are the people who are interacting with them every day. I want to, again, acknowledge our distinguished guests here, Kelly Saldana, Chief of Office of Health Systems, and Bob Emrey, Lead Health Systems Specialist, without whom we wouldn't have been able to work on this project, to achieve the advances that we have. Again, we think that we have an exciting agenda. I've peeked at it. You have the agenda there in front of you. I think we have an exciting day to really talk about the work that's happening, the advances that have been achieved, and I'm looking forward to that. It's my next task to hand the mic over to Bob Emrey to really kick us off from the USAID perspective. Bob.
Hi, excuse me. Welcome. It's my pleasure to be here in this very important occasion. The Office of Health Systems launched the Health Finance and Governance Project in 2012 to support partner countries working to improve health systems and ensure health gains are preserved. It builds on a long legacy of USAID investments in this area, going back almost 30 years, actually, as it turns out. I had the privilege of managing the first of these projects in a series a very long time ago, starting in 1989, in a project that was called Health Finance and Sustainability. In the room, actually, is one of the designers of that project, Robert Clay, who was my boss at the time in USAID, and many people have played a role in the project's development and management since then. The current management team is led by Dr. Scott Stewart, who is a health economist and unfortunately is unable to join us this morning. And our technical advisor is Jody Charles, who's sitting over here, who is our lead person on health governance. Many countries are embarking on health system changes as they move toward universal health coverage, and are giving attention especially to financial protection and equity and access to quality of health services. To achieve this goal, the countries are turning to domestic financing for health and stronger health governance to ensure the results are devoted to the health sector and achieve the intended results. We're working in 40 countries in the HFG project, and they're striving in all of that activity to fundamentally strengthen the health systems in ways that benefit all the health services and improve health outcomes as well. In particular, USAID addresses in its work in the health sector 3 health priorities: preventing child and maternal deaths, controlling the HIV/AIDS epidemic, and combating infectious diseases. It's my pleasure to introduce Kelly Saldana, the director of our USAID Office of Health Systems, where our project is managed. Kelly has over 15 years of public health administration experience and work in international development. She served in a variety of roles in USAID, including most recently as the Deputy Director of the Office of Health, Infectious Diseases, and Nutrition, and earlier was our lead health system person in our Latin America Bureau before that. She's had a wide variety of health program responsibilities through her career, and more recently has been one of the lead people involved with the Haiti earthquake response, especially giving attention to health system strengthening in that area, and in the lead to the response to Zika most recently. The agency has an Acting on the Call initiative with UNICEF, and the way she has been central to the development of an annual report each year, which gives attention to the work of the maternal child and preventive child and maternal deaths activities of the agencies involved and the countries that are participating in it. By Kelly's leadership, the reports that have been published as a part of that the Acting on the Call process have featured very innovative health systems activities which have been developed as a part of those programs. So now I'll turn it over to Kelly.